Initially, I was thinking about going to med school, and then around the time of undergrad, my last year of undergraduate at UCLA, I started actually developing jaw pain, headache, that sort of thing. Went to a lot of practitioners, went to a number of dentists, doctors, ear, nose, and throat specialists. No one had any idea really what was going on. And then it wasn't until I went online and realized, well, most of my symptoms sounded like a TMD, temporomandibular joint symptom. That's when I started to see specialists in orofacial pain. The unfortunate thing is because it's not, at that time, it wasn't an official specialty. There were a lot of people that were practicing orofacial pain that maybe weren't, the most conservative, and so I got a lot of options, and it was slightly frustrating. It wasn't until I went to UCLA and saw one of the orofacial pain specialists that I realized that, finally they put a name to my diagnosis and basically kind of guided me in a more conservative approach, and through that I got better. And this is a few years of just horrible jaw pain. That's basically the reason why I went into this field and went into dentistry, because I enjoyed this specialty. It's not just dentistry, it's not just teeth. It involves neurology, anesthesiology, general practice. It's an interesting field. Typical patient is someone who has suffered through years of TMJ or TMD, headache, have seen a number of specialists, so ear, nose, and throat, primary care, have gone to a number of chiropractors or physical therapists and just haven't been getting better, or have seen their dentists and think that they have tooth pain, and so they'll see their dentist, the dentist will think, okay, maybe there's a cavity there, they'll do treatment, they won't feel any better, and so they come to us, and then we eventually do our workup and we address whether or not the pain is TMD related. And oftentimes at that point, since they've seen a lot of specialists who have ruled out other secondary conditions, oftentimes it usually is something TMD related. And so we'll address their symptoms, and then if it is TMD related, most of them get better. Similar to the experience that I had, it's finally reaching a diagnosis. It's finally naming an illness rather than chasing something around. It's finally saying you have temporomandibular joint disorder, or you have myofascial pain that's causing this pain. And so it is gratifying and satisfying when you finally get to the point where their symptoms decrease, that they can actually manage their symptoms and have either a low-grade pain that only occurs intermittently or have no pain at all, and so they could actually function for their daily lives. The jaw is a very intimate sort of area, and you use it for laughing, talking, everything, discourse, and so when you can't do that, it's very debilitating. So it's nice when you see patients that are getting better because they're happy, they can live their life.